Cancer is caused by changes, also called mutations, in the DNA inside our cells. DNA is like an instruction manual that tells your body how to grow and develop. Normally, cells grow and divide in a controlled way, but when these tiny changes occur and disrupt that control, things can go wrong. Cells can start dividing out of control, and that can form a tumor. And if it's aggressive enough, that tumor can spread and invade other parts of the body. Now, this isn't totally random. There are certain things that can increase your chances of getting these mutations. So here are the top 6 things that cause cancer. No. 1. Genetic factors. We inherit half of our DNA from our mothers and half from our fathers. So if either parent has a genetic variant that increases cancer risk, we have a chance of inheriting that. For example, mutations in the BRCA1 and BRCA2 genes are linked to an increased risk of breast and ovarian cancer. But having one of those genes with a mutation doesn't mean you'll definitely get cancer, it just means you have a higher chance. The other thing to consider is some people have a higher baseline risk of cancer, just based on their family history. So let's say there are a cluster of cancer cases in your mom's side of the family. Like 3 or more of your relatives on the same side had cancer. If that's the case, you might want to talk to your doctor about genetic testing. Number 2, environmental and lifestyle factors. These factors can damage DNA over time and raise your cancer risk, but it's usually not a single thing that causes cancer. It's long-term exposure to these things. Let's take tobacco smoke, for instance. One cigarette contains at least 7,000 chemicals, and around 70 of them are known carcinogens. Carcinogens are substances that can increase the risk of cancer. Now, it's not just lung cancer we're talking about. Tobacco smoke is strongly linked to throat cancer, mouth cancer, tongue cancer, as well as cancers of the esophagus, stomach, pancreas, kidney, bladder, and even the blood. Then there's radiation. See, radiation isn't always harmful. Our bodies need some exposure to UV radiation from the sun to make vitamin D, but too much UV radiation can be dangerous. Ultraviolet rays from the sun are a major cause of skin cancer. But be careful because indoor tanning beds emit even higher levels of UV radiation, and that significantly increases your risk of skin cancer. Medical imaging techniques like X-rays and CT scans also use higher doses of radiation. So while they help us diagnose and treat conditions, it's important to keep the doses as low as possible. Let's talk about diet and obesity. Eating lots of processed meats like deli meat and hot dogs is linked to an increased risk of colorectal cancer. And remember, alcohol is considered a carcinogen too. Having more than 2 alcoholic drinks every day can raise the risk of cancers of the mouth, throat, liver, and breast. Next, low levels of physical activity are associated with several cancers like colon, breast, and endometrial cancer. Exercise helps maintain a healthy weight, reduces insulin levels, and boosts the immune system, all of which help lower cancer risk. Now, I know it's not that simple for everyone. Maybe you have health issues, or maybe life just gets in the way sometimes. But try to aim for at least 150 minutes of moderate-intensity aerobic activity each week. Next up, infections. Certain viruses and bacteria can wreak havoc on your body and increase the risk of different types of cancer. For example, human papillomavirus, also known as HPV, is extremely common. Most sexually active people will get infected with a type of HPV at some point in their lives. Usually it clears up on its own and doesn't cause any health problems. But some types of HPV don't go away, and over time they can lead to cervical cancer, anal cancer, and throat cancer. That's why it's recommended for people who are sexually active to get the HPV vaccine, safe and highly effective in preventing the types of HPV that cause most cancers. But it's not just HPV. Infection with hepatitis B and C is a major cause of liver cancer. Around 35% of chronic hepatitis B infections and 75% of chronic hepatitis C infections can lead to cirrhosis of the liver, which greatly increases the risk of cancer. And if you're wondering, no, getting vaccinated against hepatitis B doesn't prevent liver cancer. That vaccine only protects against the type of hepatitis B that causes acute infection. It doesn't protect against chronic infection, which can lead to cirrhosis and cancer. The only way to protect yourself against hepatitis B-related liver cancer is to avoid sharing needles and to practice safe sex. Then there's Helicobacter pylori, a bacterium that can infect the stomach lining. More than half of the world's population is infected with this bacterium. Most people don't have any symptoms. However, in some cases, H. pylori infection leads to gastritis or inflammation of the stomach lining. If left untreated, this can progress to stomach ulcers. And a study published in 2020 found a strong link between H. pylori infection and stomach cancer. So if you have symptoms of stomach trouble, it's a good idea to see your doctor. The next cause of cancer is chemical exposure. Asbestos is a group of naturally occurring fibrous minerals. At one time, it was widely used in construction and manufacturing because of its fire-resistant properties and insulating capacity. But it's been banned in many countries now because of its link to cancer. The most dangerous form of asbestos is called blue or amosite, strongly linked to a rare cancer called mesothelioma. The only way to reduce the risk of asbestos-related cancer is to avoid contact with asbestos fibers. Unfortunately, these fibers are very durable and can't be easily cleaned up once they get into a building. Then there's benzene. This chemical is found in gasoline and it's released during the normal operation of vehicles. It's also found in cigarette smoke. Exposure to high levels of benzene can cause blood cancers like leukemia. But keep in mind, exposure to small amounts of benzene over long periods of time can also increase the risk of cancer. And what's worse is that benzene is a common ingredient in many glues, paints, varnishes, and household cleaning products. So try to read labels and look for products that don't contain benzene. And it's not just benzene. Pesticides, herbicides, and industrial chemicals like polychlorinated biphenyls or PCBs can contaminate soil and water and enter the food chain. Over time, exposure to these chemicals can lead to cancers like leukemia and lymphoma. And number 6, chronic inflammation. Normally, our immune system suppresses tumors before they become a problem. However, chronic inflammation can dampen the immune response, making it harder for the body to fight cancer cells. Long-term inflammation can damage DNA and promote tumor growth. For example, chronic heartburn or gastroesophageal reflux disease, GERD, can lead to chronic inflammation in the esophagus, increasing the risk of esophageal cancer. Similarly, chronic inflammation of the stomach or intestines can increase the risk of colon cancer. People with inflammatory bowel diseases like Crohn's disease and ulcerative colitis have an increased risk of developing colorectal cancer. Autoimmune diseases like rheumatoid arthritis and systemic lupus erythematosus also increase the risk of some types of cancer. It's thought that chronic inflammation plays a role in cancer development, but it's important to note that having inflammation doesn't mean you'll definitely get cancer. Now, we've covered a lot of ground so far, but it's not all doom and gloom. Many of these risk factors are preventable. Making positive lifestyle changes like quitting smoking, eating a balanced diet, and staying physically active can significantly lower your risk of cancer. And remember, regular screenings and checkups are key to early detection and treatment. And I almost forgot, there's also something called random cell errors. Even if you're not exposed to any of these risk factors, cells can still make mistakes when copying DNA. Every time a cell divides, its DNA has to be copied so that each new cell gets a full set of chromosomes. But sometimes errors can occur during this copying process. Most of these errors are corrected by the cell's DNA repair mechanisms, but some can slip through. As we get older, the number of cells that pile up and the risk of random errors increase. That's why age is the biggest risk factor for most cancers. So there you have it, the top 6 things that can cause cancer: tobacco smoke, radiation, environmental and lifestyle factors, infections, chemical exposure, and chronic inflammation. Remember, knowledge is power. By understanding what increases your risk, you can take steps to protect yourself and stay one step ahead of cancer. Thanks for watching.